So my name is Joe McDonald and I'm the director of the Connected Health Cities programme in the North East and North Cumbria. I have previously been a national clinical lead for IT during the national programme, so I know about developing systems nationally. And I've recently turned down national positions and positions with providers of so-called national solutions in favour of coming to work here in the Connect Health Cities project, where we are developing what I like to call the Great North Care Record, which will be in due course an integrated digital care record for approximately 3.6 million people. I think that's the sort of Goldilocks size population that you can make this stuff work. Much bigger than that, and you begin to run into the problems that the national programme ran aground on. So I'm really interested in the idea that we can develop solutions locally which can then be rolled out across the country. And I'm going to just show you a demonstration now of one of those solutions. Well, in fact, a number of those solutions actually working together, because I'm actually going to demonstrate our rollout of MIG using the Cumbrian information sharing gateway tool, which is an absolute game changer in terms of getting information sharing agreements done at scale and pace. And I will also be using a product made by Microsoft. Most trusts have a license for it. It's called Direct Access, which means that I'll be able to access the MIG over the thinnest of connections via 3G, and yet I can do that securely, allowing me to work securely from anywhere. And finally, I'll be demonstrating the local development done by my own IT department, who've provided me with a button which gives me two-click access from the secondary care system into the general practice record with the kind of usability which I called Hampshire usability, because that's where we borrowed it from. And that's what we intend to do in the Great North Care Record. We're going to borrow everything that's good, apply it locally, and if we come up with something that can be then applied nationally, we will happily share it. Thank you. Good afternoon, everybody. I'm really sorry I can't be there with you today, but we've got our CQC visit. So I was asked to make this brief video about the power of local. And as you can see, mostly what you can see here is a care record. This is the Rio system. And what we've done locally is we've done some development work to add this button in the top right hand corner. And if I click on it, it gives me the opportunity to view the general practice record using the Medical Interoperability Gateway, or MIG. There's a consent model here. I have to ask the patient's consent, so it's yes, no, or break glass in an emergency. So if I click yes, it will dial up the general practice record of this patient. He was a dummy patient, so don't panic from an IG point of view. It's not a real patient, but it's on a real system. Now, we were quoted £60,000 for that button, and it would take 6 months to develop. Our local developers, our local IT department, knocked it up in 2 afternoons. So I now get this rich view of information. On that first tab, there are 10 tabs. On the first tab, I get everything that's in the summary care record. And then I get another 9 tabs, so a much richer source of information. And in fact, I can drill down into each of these items and get even more information. So I get diagnosis, I get a real-time view of medication, I get risks and warnings, I get procedures, patients already had, pacemaker, who, where and when. And importantly for secondary care, I get a view of the investigations that we would expensively repeat whenever this patient came into a hospital. And again, there's a great deal of detail about them. I can also see, for example, patient's normal blood pressure, which is pretty vital information in the back of the ambulance. We can also see where else a patient's been referred, and what other procedures they've had. So we've been able to do that largely because of local development. It wasn't national system supplier, it wasn't national systems. We've had a number of initiatives which have made it possible, one of which is the Information Sharing Gateway, which was developed in Cumbria. And if I can enlarge this, there you go. I hope you can see the map. Each of those dots on the map represents a practice who have signed up to share information. So the Information Sharing Gateway developed in Cumbria, now shared across the northeast, and I think this is a great example of actually some of the solutions which people are developing locally can be nationalised and spread if they're good enough. So I really hope that the programme can get behind the idea of supporting local solutions that we can then nationalise, and I hope you have a good meeting and that this example is of some use.